quiet town of Mission, Texas, patients flocked to the office of Dr. Jorge Zamora-Quezada, a respected rheumatologist who had built a reputation for providing expert care. For years, families placed their trust in his hands, believing his diagnoses were accurate and his treatments life-saving. But beneath the polished facade, something sinister brewed. A healthcare fraud scheme so massive, it would later shake the community to its core. For more than 2 decades, Dr. Zamora-Quezada orchestrated a complex web of deceit, falsely diagnosing countless patients with rheumatoid arthritis and other chronic conditions. These were not innocent errors. They were deliberate lies, designed to trap patients in a cycle of unnecessary treatments while siphoning millions from insurers. Patients were told they had lifelong, incurable diseases. Mothers broke down in exam rooms. Fathers canceled dreams of retirement. Young adults abandoned college plans, believing their futures were erased by illness. One patient described life under Zamora-Quezada's care as being in a body that felt 80 years old, unable to cook, bathe, or even rise from bed. Another mother wept as she shared how her child had become a lab rat, subjected to relentless procedures. These weren't benign treatments. The medications carried devastating side effects. Strokes, hair loss, necrosis of the jawbone, liver failure, and crippling pain. Each injection, each infusion, each unnecessary MRI was a step deeper into a nightmare manufactured for profit. Inside the clinic walls, the atmosphere wasn't one of healing. It was one of terror. Former employees testified that Dr. Zamora-Quezada ran the clinic like a tyrant. Staff were given strict quotas for procedures, not based on patient needs, but on financial goals. Failure to meet targets wasn't met with disappointment, it was met with violence. The doctor, who arrogantly called himself La Eminencia, once hurled a paperweight at a worker whose numbers fell short. He preyed on vulnerable employees, hiring those on J-1 visas, knowing their immigration status tied them to his will. Those who resisted or questioned his methods were fired without hesitation. The lies didn't stop at diagnoses. When federal auditors closed in, Dr. Zamora-Quezada turned his deception to the paper trail. He ordered employees to fabricate patient records. "A parecer," he said. "Make them appear." When real patient files went missing, staff were sent to a rat-infested, urine-soaked barn to retrieve documents. In one astonishing act of fraud, the clinic used ultrasound scans of employees, passing them off as patient scans to deceive insurers. Each lie built the illusion that hundreds of people were sick, when in truth, many were perfectly healthy before walking into his office. While patients deteriorated under toxic treatments, Dr. Zamora-Quezada lived like royalty. Investigators later revealed the spoils of his crimes: 13 real estate properties spread across Texas and Mexico, a private jet, and a gleaming Maserati Gran Turismo. His home was lined with marble floors, lavish decor, and art, all bought with the pain of others. Each check from Medicare, Medicaid, TRICARE, and private insurers was a step further into decadence, while his patients sank deeper into despair. The fraud didn't go unnoticed forever. It began with quiet suspicions from other rheumatologists in the Rio Grande Valley. One doctor testified that of the hundreds of patients referred from Zamora-Quezada's clinic, the majority had no trace of rheumatoid arthritis. It wasn't a coincidence. It was a pattern of blatant fraud. The FBI, the Department of Health and Human Services, Texas Medicaid Fraud Control Unit, and the Defense Criminal Investigative Service launched a joint investigation. Data analytics teams unearthed the staggering $118 million in fraudulent claims, along with over $28 million paid out by unsuspecting insurers. The courtroom was packed as a jury listened to 25 days of testimony that painted a horrifying picture of greed and cruelty. Victims shared harrowing stories. The mother whose son became a lab rat. The woman bedridden with pain from drugs she never needed. The families whose lives were rewritten by a disease that never existed. Former employees described a clinic drowning in fabricated files, threats, and manipulation. Prosecutors revealed the breathtaking scale of the fraud, one of the largest in Texas medical history. When the gavel fell, justice was served. Dr. Jorge Zamora-Quezada was convicted of 1 count of conspiracy to commit healthcare fraud, 7 counts of healthcare fraud, and 1 count of conspiracy to obstruct justice. The sentence: 10 years in federal prison, followed by 3 years of supervised release. The court also ordered him to forfeit $28,245,454 in assets, including the jet, the Maserati, and every property tied to his crimes. The message was clear. His empire of pain would be dismantled, piece by piece. At the sentencing, Matthew R. Gagliotti of the Justice Department declared, "This is not just a punishment. It's a warning. Healthcare fraud wasn't a victimless crime. It was trauma inflicted under the guise of care." Special Agent Jason E. Meadows added, Zamora-Quezada abused both patient trust and public resources. The FBI's Aaron Tapp echoed, "The physical and emotional harm to the victims was profound. This case wasn't just about money. It was about lives ruined." In the aftermath, policy shifted. Medical fraud investigations ramped up nationwide. Clinics were audited. The healthcare fraud strike force intensified operations, building on the lesson that when doctors become predators, the system must fight back. Since its formation in 2007, the strike force has prosecuted over 5,800 defendants responsible for more than $30 billion in fraud. Zamora-Quezada's downfall became both a case study and a cautionary tale. Despite the verdict, for the patients, the real victims, the sentence couldn't erase the damage. Some live with irreversible injuries. Others mourn years lost to pain, fear, and medications they never should have received. As one victim quietly said leaving court, "We trusted him with our lives, and he stole them." Subscribe to the White Coat Crimes for more shocking true stories, medical crimes, medical mysteries, and the dark side of healthcare you were never meant to see.